Okay. As a preliminary matter, this is Veronica Bolchik, Chair of the Council for Human Services. Permit me to confirm that all members are present. When I call your name, please respond. And let me see if I can get my participants here. Okay. So we have Kelly Steppen,
Here.
Stu Minthinen,
Here.
Suzanne Keating,
Here.
Tara Restieri,
Here.
and Sarah Wright. Sarah, we can't hear you.
Here.
Okay, thank you.
Thank you.
Uh,
Sorry.
that-
Very late.
That's okay. Staff members, when I called your name, please respond in the affirmative. Jericho Melee
Here.
and Tamika Gary.
Here.
And we have two guest speakers today. We have Deb Dubois from The Warming Place. And we have Janice from the Interfaith Council. And so good evening. Sorry for this restart here, but I think we should be okay now. This is a open meeting of the Council for Human Services. It's being conducted remotely via Zoom. Please note that this meeting is being recorded, that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer. Anything that you broadcast may be captured by the recording. Now we're going to turn to the first item on the agenda. So we've established a quorum. Can I have approval of a motion of approval of the agenda?
Motion to approve. It's
Second.
Tara. You know.
Okay,
And Sue seconds.
thank you. Okay, so today we have a presentation by the Warming Place through and I'm sorry, I really am fumbling with my words here. I've got a couple of things happening at the same time. But through the town generous grants from the town, the Warming Place this year is a recipient for 2025 of some grant money from the council, from the Department of Human Services, and a relatively newer organization on the island. So we have asked Deb Dubois to be here today to tell us a little bit about all the wonderful things that you're doing there. So Deb, take it over, please.
Okay. I thought maybe I'd give just a brief background as well, since not everybody may know about what we've been doing and how long we've been at it. We started back in 2021. That was our first season, and we called it a season because we're not year-round yet. We are open from November 1st to April 30th. And the first year and the second season, we didn't have a spot for people to stay overnight. So when the temperature was 32 or 34 degrees, depending upon the fuel temperature, we would put people up at the Cliff Lodge. And that worked in the first year, but the second year, we more than doubled the number of folks that were coming, and they just couldn't keep up with the demand. And we couldn't find another hotel who would help us out. So this last season, we've worked with 3 different churches now for the shelter. So we're at the Summer Street Church, the UU Church, and also the Methodist Church. And we're open 2 days a week from 10 to 1, where we serve lunch. And we try to connect people with services at that meeting. We're collaboration with Fairwinds, and also Sarah's going to be there next Monday with a representative to ensure that our guests know what services they may qualify for. And then we're open now 7 nights a week, and we open at 6 o'clock. Then we serve a hot dinner, and then people stay overnight and they get a light breakfast, and then they're out the door at 7:30. We have all different kinds of people that we serve. We have people with chronic mental health problems, alcohol misuse problems, but we also have day workers who just don't make enough to find an affordable housing. So they had been maybe living in a car or a shed or at their work site, and so now they're able to stay overnight at a warm place and have some camaraderie. We also have had 2 students come to the shelter, and one has been with us for 3 months. And that's unfortunate, but that's how it is. So we are serving a broad swath of people in the community. To date, we've had 19 people come to either the day shelter or the overnight shelter during this season. And typically overnight, we have 8 people who stay overnight, and it will depend on who's who. We've been very fortunate that the community really has been very supportive. We have over 50 volunteers now. How the evening shelter is run is we have 2 volunteers who are there at 5:30 who set the shelter up and also register guests for the evening and serve the meals. Then we have paid overnight staff, 2 people stay all night to ensure the safety of the folks who are staying there and also the safety of the churches. And that's our biggest expense is our overnight staff salaries, because they're working 12-hour shifts, 2 people, 7 nights a week. So it just adds up. We've been very fortunate that a number of restaurants rather, have been donating food either for nothing or for the most at cost. And so that's been very helpful as well. And we've had donations from a Marine Home Center for goods. We have even the Daisy Troop sent Valentine's Day bags in for the guys and gals with socks and candy. So a lot of people know about what we're doing, and we have a lot of support from the community. So that's basically what we're doing. And we appreciate the opportunity to come and talk to you. Yes.
Question: How are people finding out about the warming place? And do you think that there's more people that are out there that could utilize the service? And also, how much space could you, like, if you have you've got 8 people that are regularly overnight, how many could you accommodate?
Yeah, we can accommodate 12 people, but that's the most. We probably could fit more people at the Methodist Church and Summer Street Church, but the UU Church is a pretty small space.
Yeah.
So that's our capacity right now. How many more people are there? We probably think that there's at least double that amount. We know some people who are unhoused who don't come to the shelter. For instance, we know at least 2 women who are living in their cars, and they've made the choice not to come, although we could, shelter them separately from the men. They've chosen not to. One has a severe mental health issue, and I think that's why she's chosen not to come. And the other one wants a private room and bathroom, and that's why she's decided not to come, because it is a group setting, of course. And Tara, I think you had one other question there.
Yeah, it was how are people finding out about you?
Yeah, okay, that's a good question. Although we put posters up, and we also have postcards that we give to various organizations, like the hospital has them at the check-in and also in the emergency room department. We've gone to the police department, and although they don't hand out our postcards that have where we are, the police chief has asked them to download that information on their phone So when they go and do wellness checks, they can show people where we are. But I think the biggest way that people find us is by word of mouth, that they get referrals from people that they know who are in the same situation. Because
Yeah.
sometimes they hang out at similar places like the Stop
Yeah.
and Shop and Cumbies and things like that.
Yeah. Thank you.
Yep.
Sure.
Deb, can I ask a quick question also?
Sure.
Thank you. I didn't think to ask this when we met last week, but as it relates to what's happening elsewhere in the state, do you have a sense of the 19 or any, the immigration status of the 19 or any undocumented immigrants? Do you know?
Yes, we know that. I know at least one is undocumented. There may be more. We don't ask that question, but we do know that there's one.
Thank you.
Deb, I'll ask a question.
Oh boy. And you know the answer.
I do know the answer, but I'm gonna pose it anyway.
Okay.
So the shelter, does it support families or just individuals right now?
Yeah, right now it's only individuals and only people over 18 or over. So it's for adults. But in the future, we'd like to get our own place so that we could accommodate families for sure.
Can I ask Sue or
Yes.
both of you a question? Do you think there's a fair enough, I'm afraid of the answer, but are there a fair number of families that are in situations like this?
Yeah, for sure. I mean, Janice can speak to this as well because she often helps people stay in, their rental or wherever they are, but there are evictions that are happening. So families are out because of that. I think also people lose their rentals. I mean, I know somebody today, she's been it's not a family, but she's been in the same apartment for 22 years and now the house is being sold and she's being told she needs to find some place to stay. And I guess we all know how tough that's going to be.
Yeah.
So that happens, I'm sure, to families as well as individuals. Janice, you probably know better.
Going to mention that one of the council's outreach programs is rental assistance and utility assistance, and we're just inundated with folks who have difficulty paying their rent, particularly in the off season, get threatened with eviction without the proper eviction procedures. I try to educate them through that. And then we have people who do the shuffle and people who just get tossed out for a variety of reasons. And so we can jump in once they find somewhere else that is safe and permitted, and then we jump in and pay the rent. We have, and Deb knows this, last year we did pay the rent for a couple of the homeless folks who were employed, and we were able to put them in a rental situation versus a overnight hotel situation, because I need to see a rental situation. We paid for the month, and for a variety of reasons after a period of time, one was fine, but the other could not follow the rules of the hotel. And we just said, well, fine, we'll have to find you somewhere else, but you have to understand, you have to follow the rules of the lease. So all of that stuff goes on.
Jericho?
So I wanted to add an additional and increasing cause of housing insecurity is human housing code violations, substandard living, and a variety of related issues around the extremely volatile housing market on the island. One of the things that Deb and I think we have a meeting next week to try and close the loop on the health inspectors, who are the people who unfortunately have to serve the notices of eviction. And so we're trying to close the loop so that they're fully aware and we can do a warm handoff to temporary housing and then see if there's ways to either keep people in homes or make sure that people are aware of the rights that they have in that circumstance, which is relatively challenging.
Right. And as Jericho knows, we did have a temporary program where if someone lost their housing as a result of an emergency, more likely a flood, some construction issue, then we could jump in on that for a few days. But housing the homeless who are not in that kind of situation requires a little more thought. And so I assume that what this group will meet next week. We will, both Deb and I won't be there, but Tom will be there in my place. And Sarah, I think the hospital will be there, and I think Amanda from Fairwinds will be there. So, yeah.
And I think we're also planning to talk about high school students who have
Right.
lost their housing as well.
Right. I'm currently paying the rent for one of them. But they have housing, they've been taken in by someone in a legitimate rental housing situation, so is able to handle it, but many of the others don't have that, i.e. the person you're housing.
Suzanne?
Yes, I had two questions. The one was about the student and I thought, wait, are we talking high school student because it's 18 or over?
I do want to be very careful about any identifying information related to,
Yeah.
it's my teacher genes. They're just in there. Sorry.
Yeah. I don't need
Yep.
to know. I don't want to know, but I'm just wondering how safe it is and where, and I think Janice just answered that question. So, but the second part of my question is, when the people, do you have, Deb, the facilities at the warming center for people to shower?
No, but good news is we just started showers 2 weeks ago.
Oh.
Health Imperatives has an upstairs bathroom that has a shower. And we've been looking for 2.5 years, and all of a
Yeah.
sudden we find out that this is available. So we've been doing showers the last 2 Saturdays between 2 and 5 o'clock. And so we offer that to the folks.
And how do people know about it or get in touch? You'll give them the information at the warming center?
Right. Yep. We do that at the day center and then at the evening center. And the last 2 weeks we tried to make an appointments, but our clients aren't very reliable with appointments. So this Saturday, we're going to try something different. We're just going to be open from 2 to 5 and said, come at any time.
So we have a lot of people that, I say a lot, but several people who hang out at the library in the day who don't have
Yes.
anywhere else to go. And so that's one of the issues is, they kind of need a bathroom more than just our bathroom, a shower. But, and is there something like we could put up, we do have the poster for the warming center and stuff, and we have that
Right.
information at the library, but is there something we could add maybe to let people know where they can go and when? Because
Yeah, I
I
think
don't know
that's-
where the Health Imperatives office is myself. I have no idea where
Okay.
that.
Yeah, it's attached as part of the Fairwinds building, if you know where that is.
Okay. Yeah, I do.
Yeah, I think that's a great idea. Maybe we can make a poster, but for limited circulation, I think. Because what we like to do is have qualified people that we know show up for showers. I would hate for
Yeah.
all of a sudden there to be 20 people and we don't have the resources to do that.
Right.
But the library certainly is a good place. And the other thing is, if folks don't want to stay over, they're still welcome to come for dinner at the warming place. And we have
Oh.
a couple of people who come for dinner and then leave.
Okay.
Well, Jericho, I see your hand up again.
This is maybe more with my human services director hat on than anything else. Do you have a sense of what this potential population is? I know you're capped at 12 to say, but how many people do you believe could avail themselves to your services if they were aware and willing?
And willing, that's the big thing, I think.
Right.
Our best estimate now, although we haven't done an official count because it's really tough to do that, is around 40 people. We think it's twice as much. But again, there are some people who choose not to come for a variety of reasons. Everyone is welcome, but you know, it doesn't work out for everybody.
I was gonna say the kind of the definition of homeless for HUD. Can you tell us that? Because you probably know it better than I do at this point.
Yeah, there's actually 4 definitions, 4 different levels at HUD, but the people we are serving now are considered the truly homeless, where they're living in or staying overnight in some place that's not meant to be used by humans. So that could be a shed, it could be a car. I think even camping counts for that, because people, at least long term, shouldn't be in a tent. But then there's more complicated homelessness as well, like students can be classified as homeless if they're in someone else's house, for instance.
Yeah, I think we have a lot more people that couch surf or are in
Right.
overpopulated living situations that are real
Right.
houses, but if you've got a family in each bedroom, I don't think that constitutes as safe or healthy.
Yeah, we know, especially the immigrant population, there's a lot of just inadequate and really unsuitable housing where you'll have a family staying in a room, or, you know, 6 people staying in a basement. The issue is, though, if you kick all those people out, then there's literally no place for them to go. So it's a tough issue.
Okay. Deb, I have 2 questions. Before you mentioned that Cliff House was your first location for your overnights, was that by their donation, or because that's an extremely generous thing for them to offer? How was that connection established?
Yeah, they had helped out a couple of people who Linda Simmons knew, and I think also Father Max. And we negotiated the first year, I guess, and the second year too, a very good price. And so they were willing to help us out. And the owner was interesting because, you know, we didn't accept any liability when our guests went there. They assumed all the liability. And Marie said to me, well, you know, people come in and check in every weekend and I don't know who they are. So she was very liberal and helpful and supportive.
Yeah, I think that's very important for our community to know the generosity of our businesses, and particularly the Cliff House, in getting you established. So
Yeah.
thank you for, and the second thing is the restaurants, who I assume, are they on a discounted price, or also donations? What is the extent of their donation?
Yeah, it's a combination of both. Some of them are outright donating, and then we have a relationship with one restaurant where we pay them what I think is a, you know, a very good rate for us per meal.
Okay. And can I ask, you touched upon, just future plans. What do you envision down the road? Because there definitely is a need, and unfortunately, I don't see the need going away anytime soon.
Right. Well, we would like to have a year-round facility. This 6 months, you know, Sarah and I have talked about this. You know, we help people for 6 months, and then May 1st, you know, they're back in a bad situation. I think what we started with was a life-saving effort to help people during the coldest months so nobody would freeze. Also, it helps prevent a lot of illness. So we're really looking to become a year-round shelter. And we would also like to expand it so it's not only individuals, but we could take a couple families on an emergency basis or an interim basis as well.
Mm-hmm.
But that's
Okay.
going to take us, you know, someone donating a house, or us having a large capital campaign, or us building something. So I think that's at least 3 years out.
Exactly. The other comment I have to make is health imperatives, and obviously Sarah with the hospital, fair winds. It's wonderful to see collaboration taking place with all of our human services organizations on the island. It takes a village, and obviously that's pretty obvious with what you're doing. And so thank you to the Warming Place and Interfaith Council and all the organizations that are reaching out and becoming part of this great effort. So
Right.
thank you. All right.
If I can just add, I will shout out to the churches that host us. Some for no fee, some for nominal rent. But yeah, it's not without expense. Those buildings are heated for us. And we all
Right.
know how much heat costs.
Right. And also the Rotary has, was our 501c3 sponsor for a year, and they were very helpful as well. And the Community Foundation has helped us and Remain Nantucket. So we've gotten grants from a number of places, Cape Cod 5, Rockland Trust. So it's just been great.
Okay. Fabulous, fabulous. Any other comments or questions?
Veronica, if I can just add one thing to this discussion, which I really appreciate all of the information and of course your kind words. One of the things that I think we really don't know is if the Warming Place were to suddenly, go year round, I guess maybe the numbers could double or not during, certain months or not. I think, we just have to see how that went. But what I do think is completely unknown right now is how would a year-round shelter alter the thinking and the behavior of people who have never had that option before, right? So it's one thing to say that people choose to sleep in their cars or choose to camp in their tent and and all of this, but I don't think they've had this an option, right? So I really don't think we know the answer to that. But more to the point, I also think that we may believe that it's, Deb just talked about life-saving stuff during the cold months when people could actually freeze to death. But I also think there are a lot of other health risks when people are living in cars and sleeping. And I really know that the tick-borne thing is such a huge problem here, and people who are sleeping on the ground and so forth. I mean, I'm starting to hear more and more of these stories that involve people being exposed to the elements, even in the warmer weather. So that's all.
Yeah.
Thanks.
Absolutely. Sarah, you're right, especially about the tick disease has really affected at least 2 of our clients that I know about in significant ways.
Yeah, it's not necessarily just health risk, but overall quality of life. And I think Deb, you broadened my understanding when you gave general demographics of who the individuals coming to the shelter. We have workers who are working but can't afford or can't find a place. So it's not your typical what I would think coming from off island, what I would assume a homeless individual is. Homeless definition is certainly much broader than not having a roof over your head. Think about the people that couch surf, during, for years and years, not just for the season. So Nantucket has some unusual situations, but it's a need that is not going away, and I don't anytime in the near future. So thank you.
Can I just flesh one thing out a little bit, just to kind of break out that demographic part a little bit more? So I registered a new guest on Saturday. He's been on the island 19-20 years. we've got a couple of native Nantucketers that have been using our services for the past 3 years, who have been, they've been here their whole lives. They're in their somewhere between their 40s and 70s. Like it really covers the gamut. Whether they've been on the island 6 months or 65 years.
And the other thing is what we've really uncovered, which is a little surprising to me, is that people don't want to leave Nantucket. I guess just like us, they consider this their home. So even though there's transition houses and rehab off the island, people are very reluctant to go.
Certainly, this is their home, and where their community is, and their connection, and where they feel safe to a certain degree.
Absolutely.
Deb, if people ask, what do you need? Because I know that people do watch our broadcast, and people do also ask, what would you need as far as donations or things that people can provide?
Right. If people like to donate, the thing that we really like are Stop and Shop gift cards that we give to folks. We found that these are incentives for people to come, and then they stay, and then we can provide additional services. So that's the big thing. People have liked to give us clothes and blankets, but we prefer that to go to the second shop. Because we don't have a lot of storage. And the second shop is, outreach of Fairwinds. They allow our guests to come there and get clothes for free. So that's a place where we can go. The other thing, frankly, that we like is money, because as I was mentioning, the staff salary is the big piece of running this.
Mm-hmm.
We'd probably take a house too.
Very good, Sue.
Well, you know what? You never know. You never know.
That's right.
If you don't put it out there, you don't put it out there, it's not going to come. So all of the above, except for clothing, bring the clothing over to the second shop. That's for sure.
Yes.
Because I also realize it's like a nomad group. You're traveling between 3 different locations. So you've got a lot of challenges, but obviously you've risen to the occasion. So thank you. Any other comments? Tara?
Last question, Deb. In terms of the food that you actually have to pay for, the meals you have to pay for, is it at least at a discounted rate, or is it something that
Yes.
it's just
it's at a significant discounted rate. There's one restaurant that actually provides lunch and dinner one day and then 3 other dinners. So, it would be a big ask for someone to donate all of that.
Yeah.
But we're going to keep looking because we'd like to have all our meals donated, of course.
And the Stop and Shop gift cards, because I know we've talked about this as a council before about the limitation of use, meaning that if somebody's allowed to, if somebody has a gift card, it can't be used for things like purchase of alcohol or things like that. Is that?
Well, they don't sell alcohol.
Yeah, the gift card can only be used at.
I guess I don't even know that because I wouldn't try. I never tried.
Yeah.
Right.
Okay.
But it's just for Stop and Shop, and Stop and Shop doesn't sell alcohol. So but they've got the ability to buy personal care items, food, anything. So Stop and Shop gift card certainly is something that people can donate. Where would people send a donation? Do you have a P.O. box?
Yes,
or
we have a P.O. box, and people can send checks. Even though we're part of the Interfaith Council, they can send it directly to us, which would be the Warming Place, and it's P.O. Box 3334, Nantucket 02584.
Okay, thank you. Thank you.
I may reach out with that to ask for that information in a shareable format, and then start chucking that into some of the town communications.
That'd be great. Thank you.
But I would also mention that any donations coming to to the Interfaith Council at our official box, and it is designated for the Warming Place, will be put into the Warming Place account. Because we have to account for all of the donations that come in anyway.
Okay, thank you, thank you. This has been fabulous. Deb and Janice, thank you for enlightening us, and you know, best of luck as this continues to, as your organization continues to grow, because we know that the need will obviously continue to grow. So thank you.
And
I
thank
just
you for
wanna
having
thank-
us.
I want to say thank you for all you do. It's wonderful.
Well, same back at you guys.
Very good. Thank you for joining us today. So let me just do this here. So now we're going on to the next item on the agenda, which is an update on the Human Services Review. And Jarek, I'm going to have you do that because we did just receive an email today on that. So if you can take that, please.
Absolutely. So a tiny bit of background, over the fall and holiday period, we secured a consulting contract with Raftellus to help us evaluate a variety of efficiency improvements, to map out the currently existing process to best inform changes, and to provide some suggestions on things like timeframes, modes of communication, and a variety of other efficiency improving measures. Basically, we're hoping to update the grant process from its 1986 standard to something a little more modern. Ideally using some advances in technology and communication to make it significantly less labor intensive. So at the moment, what we're doing is there will be some stakeholder interviews coming up in April. There should be some people on this who have received invites to that. The members who are on CRC. Tara, this is what I was mentioning earlier. I might want to drag you in to assist Raftellus by giving them your cheat sheets from Greenwich, basically, and try to kind of implement as many of the best practices elsewhere here to sort of improve the efficiency of this process with an end goal of potentially asking for more money or pinning resources towards some externally determined benchmark. So once that process is underway, they're doing background research now, benchmarking us towards other municipalities. And then we're going to move to a stakeholder interview in April, the 23rd and 24th. Those invites are out. They include members of CRC, Select Board, a variety of different people familiar with nonprofit on the island. And they're basically going to be some sort of fact-finding and process mapping procedure. From then, we will be, according to the timeline that Raftellus gave me, we should be getting some recommendations out by the summertime. So ideally, we will have new measures in place and a new process or a modified process this fall for the next CRC grant cycle. Then the additional wrinkle on this, and this is good news wrinkle, is that the town's strategic planning procedure has reached the state where it's beginning to add, boys, come on, is getting to the point where it is, apologies, is getting to the point now where we're moving towards operationalizing a variety of the principles there. So I've been added to the category of healthy and vibrant community. So I am going to start working on a variety of different programs as outputs of that. Those should include things like some potential tech upgrades, licenses for improved tracking software, potentially some interns to help us get kind of a pre-plan on how to bulk out our manpower while we try and implement all of the new procedures and plans. And then ideally, it should be tying into this body. Technically, this body is the priority setting body for the contract review committee. So what we're going to be hopefully doing on this is including you guys in the CRC process and the evaluation and rubric setting, as well as kind of oversight and prioritizing. There's a variety of different plans we're going to try out. It's going to be a kind of agile and nimble process, but what we should be seeing is a greater degree of integration between CHS and the grant process, and then increasing, hopefully making it so that I can effectively execute this with the manpower I have available, which is a concern because with the unification of health and human services, health is underwater right now because of the short-term rental and then licensing and a variety of other proposals. So I need CRC and I need our grant process to be as labor unintensive as possible, because I am going to be at least a year and a half before I can staff up the department at all. So this process should basically be kind of a bolts up look at the existing process for CRC, grabbing a variety of low-hanging fruit that comes from more advances in administration technology, and then kind of getting everyone on an explicit page and making systemic changes on an ongoing basis while collecting data to inform our decisions for the next year. So that's basically the HHS program. I think background is being done right now. Interviews will start in April. We should be getting potentially a work group together, potentially from this body to participate alongside and kind of assist our consultants with operationalizing the recommendations they get together. So that's kind of my next 6 to 9 months on the internal human services. And that's basically where the HHS study project is at right now. I have some more stuff to add afterwards on the general human services update, but if anyone has any questions regarding the strategic plan component or this HHS study, please feel free.
Okay. Well,
Yeah.
thank you for the update on that. Tara, was that a question? I saw your hand go up a little bit, Tara. Nope. Okay. Would you want to just go into your human service director review?
Update? Absolutely. So right now we are tracking, force a habit. There'll be a tiny COVID update at the beginning. At the moment, we're tracking some wastewater issues where there is a pretty significant spike in our wastewater. I'm in contact with an epidemiologist out of Martha's Vineyard, and we're working with state to see if there's any measures that need to happen. Wastewater measuring is an effective leading indicator, but it doesn't give you absolute numbers. It gives you state change information. So basically, we're going to have another sample collected, get that data uploaded, and see if there's a persistent spike that requires mitigation efforts at for high-risk populations. Then after that, I'm currently working on, as I mentioned earlier, some human housing code outreach and communications efforts. I've been working with the Rural Health Office on their Rural Health Equity Initiative, which is an outgrowth of the Rural Vaccine Equity Initiative. This is the last year of that program. So we're using some of that information, some of that funding and some of that networking connection to bulk out some, hopefully some early childhood education programs for parents. There's a postpartum loss group that we're trying to get launched with Sharing Kindness, which has been a big, and that organization in particular has been a big part of our behavioral health response over the last 10 to 12 months. Specifically, they've been helping us get our QPR classes going. For those who don't know, QPR is a gatekeeping training. In this case, gatekeeping is a behavioral health crisis and suicide prevention program. QPR being question, persuade, refer. So we're trying to get a good group of people trained up on these QPR principles, connecting them to additional training. We have some trauma-informed care training we're going to try and get out to the Artists Association. There's a couple of other educational programs that we're working on that are going to be kind of hopefully tied in to both a early childhood and then some senior focused outreach information as well, all under this Rural Health Equity Grant umbrella. So that's a lot of what I'm doing right now. There's an unfortunate fact that, well, not unfortunate for him. My boss, Roberto, is currently out on paternity leave. And he will be moving to Fairwinds after that. John Hedden, our chief environmental officer, is the interim director. But because Roberto has an extremely big seat to fill, we're really busy with a lot of the internal stuff going on that Roberto was handling that we didn't even notice. And then, as mentioned, short-term rental, some human housing code issues. So it is a very busy time for the health department, as it is for everyone ahead of spring or ahead of summer. So that's more or less what we've got going on. Does anyone have any questions on that update?
Just a comment from me. Sorry, Veronica, should I wait?
No, go ahead.
Okay. Really excited to hear about the, oh, I forget how you phrased it, but the pregnancy loss.
The postpartum, I think it's postpartum.
Postpartum, yeah. That's super helpful. I've had 3 different situations come up in the last like 4 days where I was looking for supports for something like that. So hearing that there's in the works is fantastic, and please let me know if I can be of any help.
Kim from
The
Sharon.
name, you mentioned the name. I only in terms of the postpartum loss. it was
Sharing kindness.
Sharing kindness. I missed the sharing part.
They're very active on the Cape. They've been doing a lot of work with youth behavioral health issues. They've been putting together some school-wide programs, and they've been incredibly helpful for us doing we're calling it the Postvention Work Group, which is a work group that was created after last year's cluster incident in June. So what we're doing now is we're trying to have a consistent ongoing work group and presence with a variety of different events coming out, and Sharing Kindness has been instrumental in getting that going. They have been really good at connecting us with off-island resources. They've been getting us expertise that we don't have access to here. And they are running several groups on the island. And then in addition, I cannot underestimate the amount of work that Community Solutions for Behavioral Health has been putting into this as well. Rosemary at CSBH has been really doing a fantastic job of closing the circle on a ton of different initiatives and sort of backbone work, and really has been helping kind of get us a cohesive, ongoing response to behavioral health issues on the island.
Has there been help with access to zuranolone, which is the postpartum depression pill that was just more recently approved by the FDA, or no? Or is that part of the process, or?
All of so the proposal came across my inbox this morning. The particular approach that this is more of I don't believe has a medical component as yet. It is more of a longer term therapeutic and kind of group activity.
Okay.
So it may very well be, but I don't know the specifics of the scope as yet.
Okay, thank you.
Tara, could you repeat your question? I missed it.
I was asking, is any part of the process or program helping people get access to zuranolone, the postpartum depression pill that was approved by the FDA? I think it was in September or October of 2023. It's the first drug ever approved for postpartum depression.
Right. Okay. So thank you. I can check here at our pharmacy as well. I'll find out.
Yeah.
Thank you. Jericho, 2 questions on QPR training. Do you have any schedule coming up that would be available for the general public?
Yes. So we have 2 scheduled dates. March 8th. Let me double check. We have a March 8th and an April.
March passed.
That passed.
I'm sorry, April.
Let's try it again.
Yeah. April 8th and May 13th are the last two publicly scheduled ones. Anyone who is curious about it, please direct them my way. We're just doing sign up with someone contacts me, and then we sign them up. The plan for that is to, after May, take a break. And over the summertime, I'm going to try and bulk out the locally trained trainers, because that has been a bottleneck, is scheduling from off-island resources, and restart the program basically as an ongoing commitment from the town to have these things going constantly, at least once a month. Alongside the open ones, I'm currently working with Ryan Mitchell, with the Artists Association, and potentially with a safe place. I'm sorry, not a safe place. Small Friends, apologies, to deliver training directly to them, QPR initially, and then as we have discussions after the QPR training, what is appropriate for example, the interns with Ryan Mitchell, one of the directors over there reached out to see if it would be appropriate to get a trainer in for them when they're doing their onboarding and orientation.
Wonderful.
Question.
Second question. Oh, I'm sorry, Suzanne.
I have a question about the QPR. Is it targeted for young people?
It is all sizes.
All ages.
There's a general gatekeeping training. There are some specific, there's a behavioral health first aid certification, which is significantly more complicated, and that has both an adult and a separate youth one. But QPR is intentionally patterned after CPR. It's designed to be a stopgap measure to get people to proper resources.
Thank you.
I have a follow-up question. Should we not
Karen.
also, oh, sorry. Is it okay to ask?
No, Tara, go ahead.
Okay.
Yes, please.
Is it already part of the process, or should we be almost mandating that all EMS on island have QPR training?
I am reasonably certain that there's some de-escalation and first responder specific training that they get, which is over and above the QPR.
Okay.
And then I know that they've been doing a diversionary and ride-along program for wellness checks with Fairwinds, which means that there's often a clinician called in on those circumstances. I am friends with a few EMS or EMTs on Nantucket, and they've been, when I've asked them about this, they don't particularly feel that this particular classification is necessary for them. But we have actually worked with the fire department to get some specific trainings to them, both internally and for their public facing.
Okay,
Okay.
thanks.
Changing subjects a bit, for COVID. A couple of, maybe a month ago, regulation came out that individuals should be seeking another vaccination. Is there anyone on the island currently giving COVID vaccinations?
No.
Okay. Is there plans to make that change?
No. At the moment, I do not have access to the Massachusetts vaccination program. I do not have a town nurse, and I do not have the ability to order vaccine. So, oh, and also the state program that was going on will not be continuing for the remainder of this part of the year. However, I did just receive confirmation that there will be state mobile clinics coming down in the fall. So I can do nothing right now. I believe the CDC recommendation was those above a particular age and or those with a comorbidity as identified in the earlier stages of the pandemic. So more or less, I do not have any vaccination resources on Nantucket at the moment. I am going to be able to and will be scheduling probably either monthly or bi-weekly, if they'll allow it, vaccinations in the fall, but I do not have the ability to do any vaccinations right now at any scale.
Okay. Sarah Wright, can I ask a question? Do you know if the hospital has any plans for this?
Yes. Thanks, Veronica. You can certainly ask, and I'm making notes. I will get answers tomorrow.
Okay.
I don't know right now.
Right, because I did check with Dan's, because Dan's Pharmacy has been in the past, but they're not making it, they don't have it available either. So I know that I was looking for one for myself. I may seek one off island just because vaccinations are important. And as you said, the wastewater samples are going up again. And even though maybe the severity of the illness is not what it was for vaccinated people, the germs are still out there. So thank you.
And it is worth noting that,
Anyone else?
so I had one follow-up to that, which is that it's not just COVID at the moment. That epidemiologist I've been working with from Martha's Vineyard has been doing a regular respiratory disease update, and there is a variety of things. We seem to, on a state level at least, have gone through the worst of the respiratory. It does line up to the conventional flu season. Things should be coming down now. But let's not forget, a couple of years ago in the summertime, we had the Delta outbreak, and we're currently dealing with a more virulent version, which probably is less severe or is at least hitting a more resilient population at this point.
Okay, thank you. Thank you. Another question, earlier when we were talking about our homeless population, ticks. Do you in the health department or human services, any plans for education programs, etc.? Because years ago it used to happen. I remember we would come over on the ferry and they were handing out pamphlets, etc. So someone who has recently had a tick infection, it's near and dear to my heart.
Probably nearer and dearer than you would like, unfortunately.
Exactly. Yes.
As a some kind of tick-borne disease illness carrier, I sympathize with that. So one of the things that is also included in the strategic plan, each element of the strategic plan has a select board sponsor, more or less, or someone who helps coordinate across departments, who is a select board member. My advisor is Malcolm, from the chair of the Board of Health as well. Tick-borne illnesses are a special concern of his. So when we are putting together strategic plan things, I am almost certain he will have a couple of ideas around how to increase our outreach and education around tick-borne illnesses. Really, I think the biggest public health risks on the island are sun exposure related skin cancer, tick-borne illness, and behavioral health issues. So those are all attempting to be core parts of, in some cases, the environmental health role, and in some cases, the community or behavioral health role. So I expect there to be expanded amounts of work on doing tick-borne illness education. I don't have a particular project yet on it, but I do know that we also have worked in partnership with the state DPH on this, because they are doing a lot of work in both invasive species related public health issues and climate change related public health issues. So this falls under the same rubric as some of their anti-mosquito measures and a couple of other public health issues. So as of right now, it is something that is a priority for the health department, but given how in flux we are, it is not our number one priority at the moment, sadly.
Okay. Well, just be aware that I think we had a very mild winter, all things considered, and the ticks are out there. So just be careful, everyone.
I think we only had about a 3-day freeze this year, which is probably going to make itself known in the summertime insect populations.
Exactly. Anything else, Jericho?
I mean, I could do this for another 4 hours, but I don't think any of
No,
us
thank
want to do that. So,
Thanks, but no thanks.
yeah, no,
All
that's
right.
fine.
We'll switch to any new business. Right. With none, our next meeting is right before Daffodil Weekend, the Thursday, so 4 o'clock then. So in the meantime, I wish everyone a happy spring and happy holiday weekend for anyone who is celebrating. And would anyone like to make a motion to adjourn?
I will make that motion.
All right. Do you have a second?
I will
I'll
second
second.
that.
Okay.
Okay. Well, let's start. Sue Minton,
Yes.
Suzanne,
Yes.
Sarah,
Yes.
Kelly,
Yes.
and Tara.
Yes.
And yes from me. And thank you all for your patience with our connectivity issues. So
No
Safe
have a great
travels.
weekend.
Safe travels,
All right.
Veronica.
Yeah.
Thank you. Off to
Take care.
Australia. All righty.
Oh,
Be well.
wow.
I know, right?
Jealousy.
Alrighty.
Have
Be
a good
well,
one,
Enjoy.
everybody.
everyone. Bye-bye.
Take something to sleep.
Good on you, mate.
Yes. I'll come back with pictures of the kangaroos.
There you go. Take
Safe
care.
travels. Bye-bye.
Thank you.
Bye.
Bye-bye. Well, no, fumbled and, so,
Connectivity thing, I mean, that's just tough. That's tough, but it worked out.
And what happened is, I think Jericho was trying to,
Fixing it, you disconnected you.
and then I couldn't get back in.
Because you lost that link.
Right.
Allow you to,
Right. And that's why I said, get the iPad. So I realized that I couldn't do it on my phone again if I was blocked from there. And I was entering the number and it wasn't working, etc. The warming place. That's the first one I've met. Deb Dubois. Yep. Well, it's gonna be underwater soon. But it's true. They've got rooms there, don't they?
they have room.
Yeah.
And rooms can be joined, so you get a suite for families. It's gotta be better, even in current condition, with the good cleaning, it's
Right.
better than what they doing right now.
Right, exactly. Exactly. It has to be.
And a food pantry, but other social service offices could be in dorm time, one side that gets cleaned every day and the other is social services or something.
Now, what's interesting, how do I turn my phone on?
Oh,
There it is. I was pressing the wrong side. It's interesting because they close May 1st.
Right.
And, so May 1st are people, they're out sleeping in the cars, they're sleeping back in the forest, they're sleeping on the beach, whatever. But I was blown away by workers that are coming there and staying. It makes sense. And
Especially if, like, I don't want to live in a room for 600.
Yeah.
Or it might be, I'm Dominican, they're from another island, and like each other. I mean, it's just, there's just so many little factors that can play in. Other people, it's like, I can't find a place.
yeah,
Two was actually pretty good.
well, this should be more.
Right, but if there's two, but there are only two right now. Right. And again, it might be some level. Have trouble